Hello, we're the Uganda group.
During the first 3 weeks of our visit to Uganda, we stayed in Kampala. During this time, we had rotations at Mulago National Referral Hospital. Although this hospital has a capacity of 1,600 beds, there are more than 800,000 admissions of patients per year. Many patients are referred here from other hospitals in Uganda. This results in an extremely high patient load. As well as the many patients, there are a lot of students. Mulago Hospital is a teaching hospital for nurses, midwives, and medical students. During our time here, we had a variety of different rotations. Each week, we were assigned one ward with 2 to 3 people, which gave us the opportunity to get to know the healthcare staff and the wards. We stayed on the emergency unit, acute pediatrics unit, malnutrition unit, and the neuro and cardiothoracic surgery. On the emergency ward, we have had the chances to see many CT scans of patients with a traumatic brain injury because there were a lot of traffic accidents, especially with boda bodas. The doctors and nurses were able to teach us a lot about what you can see on the CT scans. We also performed CPR on some patients on the emergency ward. In the acute care unit, we saw cases of malaria, tuberculosis, and measles in children. We learned about the presentation of the illness, the physical examination, and the test results. In the malnutrition unit, we learned about the different presentations of malnutrition. We found out that malnutrition can have many different reasons and is not only linked to insufficient food consumption, but also to underlying conditions like lactose intolerance and congenital malformations. In addition to Mulago Hospital, we visited Kawempe Hospital. It offers specialized healthcare in obstetrics, pediatrics, adolescent health, and HIV/AIDS care. Many of us completed rotations on the obstetrics ward and some on the neonatal ward. On the obstetrics ward, we could observe and assist with some C sections, and we learned how to deliver a baby vaginally. There was an unending line of women ready for C sections, so these were performed all day, for the entire day. In the labor ward, there were women giving birth continuously. We learned how to examine them and how to take care of the baby after the birth. On the neonatal ward, there were almost 100 babies lying at the same time. Also, at the neonatal unit, there was the world's biggest incubator with all the premature babies. In our last 3 weeks, we visited Kumi Hospital in the district Kumi. Kumi Hospital is a regional referral center serving about 4 million people with around 300 beds and a wide range of services, including general medicine, surgery, orthopedics, maternal and child care, HIV/AIDS treatment, diagnostics, and rehabilitation. It is also the main regional referral site for tuberculosis and leprosy. Compared to Malago, Kumi is much smaller and more personal. Religion plays a visible role in the daily life at the hospital, with morning services attended by staff and, on certain days, also by patients. The emergency department operates on a smaller scale and feels more like a clinic than an emergency unit. During our stay, we joined several departments, including the malnutrition ward, orthopedics, antenatal ward, surgery, and maternity. In the operating theater, some of us were allowed to stand close to the procedures, and some of us even assisted with suturing. We also joined the malnutrition unit, where children welcomed us with open arms. We helped prepare the therapeutic milk formula that is essential for the recovery of the severely malnourished children. This, together with the outreaches, showed us how much of Kumi's impact takes place not only inside the hospital walls, but also in the surrounding communities. Twice a week, Kumi District Hospital organizes outreaches to nearby villages, schools, and small towns to provide basic healthcare services. During these visits, healthcare workers vaccinate children and mothers, distribute deworming and vitamin tablets, offer family planning, and conduct HIV testing for pregnant women. The team often travels in the back of a pickup truck over rough roads to various locations. Sometimes a school or church, but often just an open space under a tree where mothers and children gather. After unloading supplies, vaccination cards are checked and the necessary vaccines are prepared and administered. At schools, additional lessons are given on topics such as washing hands and dental hygiene. These outreaches play an important role in improving access to healthcare and promoting preventive health in rural communities. We would like to thank everyone involved in making this experience possible. We had an amazing time in Uganda.